Good day everyone, I am Lea Marisol de los Santos, your student nurse from NUST BSN 3E, and now I am going to demonstrate the teaching client to use incentive spirometer. Our goal as a nurse, the patient accurately demonstrates the procedure for using the spirometer. Equipment that we needed, incentive spirometer. Implementation number 1, review chart for any health problems that would affect the patient's oxygenation status. Implementation number 2, bring necessary equipment to the bedside stand or overbed table. Implementation number 3, perform hand hygiene and put on PPE if indicated. Implementation number 4, identify the patient. Implementation number 5, close curtains around the bed and close the door to the room if possible. Explain to the client what you are going to do and why you are going to do it to the patient. Implementation number 6, assist patient to the upright or semi-Fowler's position if possible. Remove dentures if they fit poorly. Assess the patient's level of pain. Administer pain medication as prescribed if needed. Implementation number 7. Demonstrate how steady the device with one hand and hold the mouthpiece with the other hand. If the patient cannot use hands, assist the patient with the incentive spirometer. Implementation number 8. Instruct the patient to exhale normally and then place lips securely around the mouthpiece. Implementation number 9. Instruct the patient to inhale slowly and as deeply as possible through the mouthpiece without using the nose. If desired, a nose clip may be used. Implementation number 10. When the patient cannot inhale anymore, the patient should hold his or her breath and count to 3. Check position of gauge to determine progress and level of attained. If patient begins to cough, splint an abdominal or chest incision. Implementation number 11. Instruct the patient to remove lips from mouthpiece and exhale normally. If patient becomes lightheaded during the process, tell him or her to stop and take a few normal breaths before resuming incentive spirometer. Implementation number 12. Encourage patient to perform incentive spirometry 5 to 10 times every 1 to 2 hours if possible. Implementation number 13. Clean the mouthpiece with water and let it dry. And number 14. Remove PPE if used, perform hand hygiene, and document.